New about this measure is that it's now mandatory in 2015 under the modified stage 2 measures. These public health reporting measures, think reporting to an immunization registry, to a syndromic surveillance registry, or to a specialized registry, were previously many measures, meaning that they were optional. But now in 2015, they are required. In the modifications rules, CMS did reduce the threshold. Previously, to attest to these measures, you would have had to have ongoing submission with the registry. But in 2015, as long as you meet the active engagement criteria, you can successfully attest to these public health reporting measures. So what that means is that, say you want to report to a specialized registry. If you register to begin submission to that registry, then you meet the active engagement criteria. If you begin testing with them, you also meet this criteria. And of course, if you begin submitting data to them, you would meet this measure. So there is a little bit more flexibility. Yes, ma'am?
So if your EHR is not ready to submit to a specialized registry, but you already registered with them, is that okay? Can you say yes?
So the question, I just want to repeat it so everyone can hear. If you have an EHR that's not yet capable of submitting,
They're working on it.
That's not yet capable of submitting data to the specialized registry, but you registered your intent to submit with that specialized registry? Yeah, it's a good question. I'm just trying to think if CMS addressed that. I want to look into it in the final rule. They did give some specific scenarios that would meet this new criteria and see if they did give any indication about that. But what may be applicable for your group is that CMS recognized that not all EHR vendors and practices were up and ready to report these measures because they were optional. And in fact, these measures don't always apply to certain specialty practices.